Okay, so I'm currently in the medication room and I'm pulling up my patient's MAR. So the doctor is ordering for my patient Robert Reed, whose birthday is 12/23/1945, and allergic to sulfa. The doctor is ordering him 0.9% sodium chloride, which is the medication, given the route is IV, to infuse at 100 milliliters per hour, which is the dose. And the time frame is now. That being said, I'm going to get a bag of 0.9% sodium chloride out. Before I do my second check, I'm going to inspect the bag. The bag is not leaking. It is clear, and the expiration date says it's not expired. So I'm going to do my second check with my patient's medical record. Again, I have Robert Reed, 12/23/1945. He's my patient. He's allergic to sulfa, and the time frame is now, and the date's 11/5/2020. The medication I'll be administering is 0.9% sodium chloride. The route is IV, and the dosage is to infuse at 100 milliliters per hour. With that being said, I'm just going to label my bag ahead of time, and I'm going to label my primary tubing once I get into the patient's room and hang it up, just because it'll be easier that way. So I label my bag with my initials since I'm the one opening it, the time frame, which is 13:30, and the date, which is 11/5/2020. And I'm not going to put this over the bag label. I'm going to put a little bit lower so that the other nurses know what it is. Okay. So I have that. I'm going to open my primary tubing. So we take the primary tubing out of the bag, and you want to untangle it. And there's two sterile ends that should have caps on them. The spike has the cap on, and so does the hub. So those two need to remain sterile the whole time. I am going to now take my rolling chamber and move it up towards the top of the primary tubing as far as it'll go, and I'm going to close it. Once it's closed, I'm going to puncture with a spike a hole into my bag before I go into my patient's room. So I'm going to making sure not to touch that because I want it to remain sterile, and I want this part of the bag to remain sterile too and not touch that. Alright, we're going to put that in here like this so it doesn't leak. We're going to flip it over, and I'm going to put, by squeezing this little vial, I want to fill it at least halfway. Okay, it's filled halfway. And I'm going to gather the rest of my supplies to bring into my patient's room. All right, I'm going to just change the camera so it's in my patient's room. Robert Reed, I'm going to be coming into your room. Let me make sure you can see. Is that good? Yeah. Okay. Hi, Robert, can I come in?
Yes.
My name's Ashley. I'll be your nurse today. I'm going to be hanging a 0.9% sodium chloride IV solution per the doctor's order. Just grab the IV pole. I'm going to wash my hands. Can you please just verify your name and date of birth?
12/23/1945.
Okay. Do you have any allergies?
Sulfa.
All right, and I'm double checking with my patient's MAR, and those are correct. I'm going to provide you with privacy, and I'll make sure you're safe throughout the whole process. And just doing my third check, I did verify the name, date of birth, and that he's allergic to sulfa. I have 0.9% sodium chloride, which is a medication. It's going to be given IV, and the dose is 100 milliliters per hour. And the time frame is now on 11/5/2020. I'm just going to hang the bag up on my IV pole to get it out of the way, making sure everything remains sterile. And I forgot to mention, I did prime my bag before I came in, and there was only little champagne bubbles. There was none at all, and I'm going to double check that before I hook it up to my patient. So just moving everything out of the way. I'm going to put some gloves on before I assess my patient's IV site. Robert, I'm just going to look at your IV site before I hook you up to your IV solution. Okay. Make sure everything's okay so far. I'm just going to feel it and see if there's any tenderness or pain, and if it's warm. Okay, it's not warm, and you said there's no pain, no burning pain. Okay, so if it was phlebitis, it would be inflammation of the vein, which we'd see redness, warmth, and pain, which you're saying you have none of those. And if it was infiltrated, it would be cold, pale, and you'd have some pain and a little bit of swelling, which I don't see any of that, so we're going to go ahead and begin. I'm going to get my normal saline flush ready and get the air bubbles out. That way no air goes into the line. I'm going to open the alcohol pad. I'm going to wipe off the end of the patient's IV catheter for about 15 seconds. That gets thrown away. And then you can put in their line 3 to 5 milliliters of the flush. Okay, we're done with that. And now I'm going to hook your bag up. And like I said, it was already primed back in the medication room. There is no air bubbles at all.
Oh, sorry. I just
Can you
thought
see
it'd be
that?
easier for you.
Okay, there's no air bubbles. So I'm going to finally take off the sterile end of this, making sure not to touch anything else so it doesn't become unsterile. And I'm going to attach that to my patient's IV. Can you just hold that for a second? Okay, and it's intact. Before I leave the room, I'm just going to initial and date and put the time for the primary tubing. So I put my AC, my initials, the date's 11/5/20 and time's 13:30. And I would start the IV infusion pump at 100 milliliters per hour. I'd wash my hands, ask my patient if they need anything else, and put their call bell within reach, and make sure to check back on them.